Welcome to the Healthy Care Channel, your go-to source for reliable health advice. Today, we're diving into an important topic for parents: children's vaccines. Vaccinations are a key part of ensuring your child's long-term health and well-being. We'll explore the essentials, covering what vaccines are, why your child needs them, and when they should receive them. Let's break it down. 1. What is a vaccine? First, let's talk about what a vaccine actually is. A vaccine is either an injectable or oral medication designed to protect your child from serious diseases. It works by triggering the immune system to produce antibodies that can fight viruses and bacteria. These antibodies act like soldiers ready to defend against illnesses. However, it's important to note that it can take a couple of weeks for these antibodies to fully develop. So if your child is exposed to the disease right before or soon after vaccination, they could still get sick. 2. Which vaccines does your child need? As parents, it's essential to know which vaccines your child needs and when they should receive them. The good news is that doctors follow a well-established schedule recommended by experts. Let's go over the vaccines that are typically required from birth through age 6. Birth through 6 years, hepatitis B. Hep B protects against liver infections, administered in 3 doses. RSV, respiratory syncytial virus, given to either mothers or infants to prevent lower respiratory tract infections in newborns. Rotavirus, shields against a dangerous stomach infection, 2 to 3 doses between 2 to 6 months. Diphtheria, tetanus, and pertussis, DTaP 5 doses to cover these 3 diseases, starting from 2 months old. Haemophilus influenza type B, HIB, protects against serious brain, lung, and throat infections. Pneumococcal vaccine, PCV15, PCV20, prevents life-threatening infections like pneumonia. Inactivated poliovirus vaccine, IPV, 4 doses that protect against polio. Measles, mumps, rubella, MMR, 2 doses, with the first given at 12 to 15 months. Hepatitis A, Hep A, 2 doses starting at age 1. Varicella, chickenpox, 2 doses starting at 12 to 15 months. Influenza, flu, given annually starting at 6 months old. COVID-19 vaccine, recommended for children 6 months and older. Visual cue, a timeline showing the recommended vaccination schedule for young children. 3. Vaccines for ages 7 through 18. As children grow older, additional vaccines become necessary. For kids between 7 and 18 years, there are a few key vaccines they should receive. 7 through 18 years, tetanus, diphtheria, and pertussis, TDAP, a booster shot recommended at age 11 or 12. Meningococcal conjugate vaccine, MenACWI, first dose at 11 to 12 years, with a booster at 16. Meningococcal B vaccine, for older teens at risk for meningitis. HPV vaccine, protects against cancers and genital warts, typically given at 11 to 12 years. Annual flu vaccine, as with younger kids, teens should continue to get the flu vaccine every year. COVID-19 vaccine, teens may need 1 or 2 doses, depending on the vaccine type. 4. Why do children need so many vaccines? Many parents wonder why children need multiple vaccines and why they are sometimes given all at once. Scientists determine the best timing for vaccines based on how a child's immune system responds and when they are most vulnerable to disease. Spacing vaccines out unnecessarily leaves your child unprotected for longer periods. It's crucial to follow the CDC recommended schedule, as there is no evidence that alternative schedules are safer or more effective. You may also notice that some vaccines require boosters. That's because certain vaccines need multiple doses to fully protect your child, and others may wear off over time. 5. Possible side effects of vaccines. Like any medicine, vaccines can cause side effects. Fortunately, most of them are mild and short-lived. After getting vaccinated, your child might experience fussiness, mild fever, or soreness at the injection site. These symptoms usually go away on their own within a few days. However, if you notice more serious symptoms, such as severe swelling, rashes, or a high fever, don't hesitate to contact your child's doctor. 6. What happens if you don't vaccinate your child? Skipping vaccinations can put your child at risk for dangerous diseases like measles, polio, and more. These illnesses can also spread to vulnerable populations, including babies who are too young to be vaccinated or people with weakened immune systems. Remember, your pediatrician's goal is to keep your child safe and healthy. If you have concerns, talk to your doctor. Together, you can make informed decisions about your child's health. In summary, vaccines are a powerful tool in protecting your child's health from dangerous diseases. By sticking to the recommended schedule, you're giving your child the best defense against illness. Thanks for watching today's video on children's vaccines. If you found this information helpful, be sure to like, share, and subscribe to Healthy Care for more health-related tips.